And so the meeting is starting. I'm going to admit everybody. It usually takes a minute or so for everybody to come on in. And so we will get that started. So good afternoon or good evening, everyone, depending on how you prefer to refer to this time of day. This is Dominic Erlo with the New Mexico Department of Health, and we're just here to help support DezBaa with the Equity, Access, and Cultural Considerations Committee. And so we will be here to help from a Department of Health standpoint. And just to let everybody know, we do have a few people from the department who are here. We have Jorge Gonzalez, who is our program manager for the Medical Psilocybin program, Kathy Augiri, who is our project manager for our Center on Medical Cannabis and Psilocybin, Robert Truckner, who is our medical director, Ishmael Zutat, who is one of our health educators with the program and is going to be helping with regard to unmuting and muting individuals for the public comment and for the commentary area. And then with that, I will turn it on over to you, DezBaa. Thank you, and glad to see everybody here this evening. The floor is yours, DezBaa, your committee and your meeting.
All right, hi, Yate. Hi, everyone. It's been a huge slide into today is starting the first day of New Mexico legislation for the 30 days. So that's how I started the day. And with that, we want to make sure that we're kind of just creating a container and an environment for everyone at this point to just provide input. We really want to provide input. So as we're creating these meetings for all of the committees, and including mine, we also just want to encourage more people to get involved, more input. We have heard from a number of different sides. We're looking at both the, let's just say, recipient of the medicine, the patients, and also the facilitator, also the propagation and cultivators who are going to be creating this medicine for New Mexicans. There is a lot to uncover. We have, especially in the context of equity, access, and cultural considerations. For those of you who are not familiar with what's going on, we do have a tribal liaison in the Department of Health who is going to be facilitating, reaching out to all the tribal governors. There are 21, 22, some of the Pueblo governors, and they change every year. So we're still kind of getting up to date with that. We also have the Apache tribes. We also have the Navajo Nation. So we are going to hopefully be able to get input from the tribal leaders that is not like on the back burner. It is something that's the forefront, but we also want to make sure that we are addressing rural communities, all access, all different areas, cities and towns and municipalities of New Mexico. And we definitely are looking into how we can address this on both the facilitator, administrator side, as well as the individuals who are requiring and needing this medicine. And with that, we are looking at how can we look at insurance. Is insurance going to be able to be a factor in this? Does it need to? Yes. But this is all information for you to also make sure that New Mexico hears that. How is it going to be paid with the equity fund? What are those patients? What does that patient look like? From people, I always keep saying Mora because that's up north where I'm originally in that area up in the north. But we also need to make sure that anyone, even in Las Cruces or Farmington or Ruidoso, Raton, Portales, all these places, and especially the hard-hit communities, as I know, Rio Arriba County has steadily still continued to have overdoses on fentanyl use, as well as Santa Fe County has increased, I think, up to like 130% from last year. This is beginning of last year, and also to, I believe, Taos. And so these are things that we need to address, but how can we address them? And I feel like it is through community. I know that's a little bit off topic, but I want to use this time to really just, if there's anybody, we're going to do a listening session again. What I think that I'm going to be doing is having staggered meetings where it is in the evenings and it is also during the day. I know some people are, we can't all be on the same time format. And I think it's really important that we are, if it's equity, access, and cultural considerations, that we really are open to the different communities and working backgrounds that we have, especially if, you know, some of us are pulling 2 and 3 jobs at a time. So just to recap a little bit, I kind of sort of just threw a bunch of stuff at you. People have brought up insurance. I want to have these conversations about its importance, paying for this, what it's looking like with rural communities. Before we actually start getting into recommendations, we do have a short time period and a time frame of less than a year at this point. I'm looking to kind of get some more movement in these recommendations to the board, probably within the next couple of months, whether it's issues of telehealth, how does that look when it comes to rural communities, and also the cost, because it's not just about the cost for the patients, it's also the cost for training, education on the side of facilitators, and what that training is look like. Do the trainers, are the people who are going to be trained have that same access to those trainings? And so what I'm understanding as far as equity, access, and cultural considerations is how does it intersect with all the other committees when it comes to patient care, when it comes to propagation, when it comes to end of life care, that this is really truly equitable and we're able to have this medicine available to all New Mexicans who wish and seek to have access to it. And what does that look like? Okay. Let's see. And also that I know we don't really necessarily have to have bylaws, but I do feel like I'm working on them, coming to some agreement and consensus about how we're going to be voting. I definitely appreciate outside input, and by outside I mean outside of New Mexico. I think that, you know, 2 heads are better than 1, and especially when it comes to Oregon and Colorado, who have already been dealing with this. Anyone even with research or input from New York or any other place is also very valuable and important. And so your concerns and input is important, but when it comes to making sure to take care of New Mexicans here within our governance, we need to be able to have a consensus of who's being able to vote on a recommendation that will then move to the board for adoption into its regulations and more formalized. So I am working on that. I promised, I said it was gonna be a little bit more structured, but I apologize about not having it structured again today. And again, since it's only about an hour long, I really would like for anyone to has anything to start off the conversation. And I would just really want other people to start bringing in, attend also the other meetings and see where all of this looks like going forward. I've noticed that in the research that is going to be starting to move all of the information that we have when it comes to these different committees is going to inform the other one with research as we progress and as we move forward, is going to inform what kind of research that we're going to do, what kind of funding that's going to look like, and so forth. All right, is there anybody who wants to go ahead and speak up? I know we have a couple of comments in the chat. And also another thing that I'm hoping to be able to do essentially as well is to have some in-person meetings. I'm not going to make a promise. This is something that I am thinking about, what it would look like to actually go into different communities and actually having input from people face to face. if that's something that people would like to have, some kind of informational session, but also just gathering like what are the big barriers for a specific community, whether it's stigma, the use of psilocybin might be an educational and access point. And what does that look like? I will say from a personal point of view, with religious background or even I would say political leanings, etc. Those types of things may be informing what might prevent someone from thinking and feeling safe enough to want to move forward with this type of therapy. And what does that educational outreach look like? And it could be completely different in one part of the state than the other. And with that in mind, working with the tribal communities will be completely different than it might be working with the community out in Deming, where some of these places may be more hard hit. So one size does not fit all in terms of what it's going to look like. When I was working for the Navajo Nation, we had regulations from the East Coast where the soil is more acidic, and here our soil is more alkaline. That's the kind of thing I'm talking about, where one thing does not necessarily mean it's going to work in another environment. And so what does that look like for your community, to have that educational, what needs to be presented, and how does this medicine need to be shared when it comes to having those one-on-one connections? All right. Do I have anybody who has any kind of input? I know from the beginning, I do want to stop talking at some point. If there's anybody who is interested in having a concern, and it could be anything. I know from one of the other meetings before that we might feel like we're not supposed to say anything, but I also, because of the cultural considerations, but I also want to provide this idea that it is a safe space, even though this is being recorded, just FYI. This is a safe space to be able to share what your own personal concerns are. Because if it's your own personal concern or something that is on your heart or on your mind to share, that might be something that is might be on someone else's mind, and they might also not be able to feel comfortable enough to share it. But if you're speaking up and speaking for yourself, coming from your perspective, it's very helpful when it kind of moves the discussion along. And that in place is what I feel like education and outreach will do, is that when we're connecting one-on-one with each other, we're able to understand what each of us needs. Another point of concern is just the urgency. I know some people might be a little concerned with the timeline and what that looks like. So I think I hear someone trying to speak.
Yeah, that was just myself letting to know that we have two hands up. One is Esteban Hernandez.
Okay.
Let me know, DezBaa, if you'd like me to. Yep. Okay, I will unmute them. Just give me a second. There we have it. Esteban, please, you may begin.
Good evening, everybody. DezBaa, thank you so much for hosting, and thank you everyone from the Department of Health. My name is Esteban Hernandez. I am the president of the New Mexico Mycology Guild. We're focused on advocating for local mushroom farmers primarily to start, but we do look to expand our offerings and inclusion to both testing facilities as well as facilitators of psilocybin therapy. We've been meeting quite a bit over the past year to kind of discuss what we see as potential concerns for the program. And I would say the largest concern that we share right now is the potential for this entire, sector of health here in New Mexico to be taken over by out-of-state or multi-state organizations. As such, we found that the state of Oregon had implemented a sunset clause for their medical psilocybin program, which we would love to see here in New Mexico. Essentially, this sunset clause gives New Mexico residents a real chance and a first foot on the ground for access and participation within this space. By limiting participation for any sort of licensing to New Mexico residents who have held that residency for at least 2 years for the first 4 years of the program's implementation. Now, those exact figures may vary depending on our needs here in New Mexico, but I think it would be really important to offer small businesses in New Mexico, New Mexican entrepreneurs, folks who have been doing all of this work on the ground in the meantime, to really have the first shake at participating in this program. Thank you.
Thank you very much for that. We also have Vincent Espinoza. So I'm just going to unmute them. Vincent, you have to unmute yourself and begin. Just to let you know, Vincent, the microphone icon is on the top right of your screen. You should see that and click it, and that should unmute your mic. If you're having any difficulties, please drop a comment in the chat, and we can probably try and get back to you if it's not successful. That's not a problem, Vincent. What we'll do is let's see if I. So it seems here I have enabled your mic. So perhaps it might be a good idea to try to leave the chat and to jump back in. That seems to do the trick a lot of the time. So it's not the first time this has occurred. So try that out, see what happens. And when you join back in the chat, raise your hand and I will be sure to answer that. How does that sound? Okay, fantastic. We also have a hand up there from Gregory Evans. Gregory, I have allowed your mic. Please begin when you're ready.
Yeah, I had to turn it off and turn it on again. Yeah, just to give you a break, DezBaa. I'm really curious to see how we can. I don't think I'm gonna be able to spend a ton of time in this group, but I definitely want to leverage it in the ways that like it can excel in understanding you mentioned the interconnectedness between the work groups and mapping out the dependencies from deliverables that are happening across a timeline. I almost think that this group could do a lot to kind of track and hold some of those events that are happening between the groups and making certain that like known dependencies are held accountable and documented and discussed, coming to a space of like unified understanding. I'm curious if you have a minute and there are no other hands, since this is the first time I've attended this group, if there's a list of this group's requirements, what our goals are for the end, like what does success look like, or if we're just kind of like figuring that out as we get started. Thanks.
Thank you very much for that. And we have Vincent, so I'm just going to allow the mic. Vincent, please unmute and begin.
Yeah, I don't know. Is everyone able to hear me? Perfect.
Yes.
Well, wonderful. Thank you for letting me join this meeting. I'm very excited. I am a therapist and an LCSW in private practice. So I'm licensed in Colorado, Oregon, New Mexico, and I'm actually going through a training company's psilocybin certification program. They're known as Fluence, and I'm hoping to get my Colorado license as a clinical facilitator here towards the middle of this year. So I was really excited to hear, about all of these developments in New Mexico, and I think my purpose for being here is, I was born and raised in New Mexico. I was raised, very poor on Medicaid, and I know how it is to access services. It's very difficult. And, this is such a wonderful healing medicine. And I've facilitated sessions with clients, integration and PHRI, harm reduction, right? And I think it's just so important that there's a way that we make it possible for people who can't afford this, to access this. And also, I think someone had said earlier, preventing corporations and multi-state entities from coming in and making it, too commoditized and unaffordable. So that's kind of why I'm here, and that's what I'm hoping to, assist with if I, can be a part of this in any way. I would love to. And so, yeah, thank you all for having me.
Thank you for that, Vincent. Next, we have Aaliyah. Oh, your hand is down. I don't know if Aaliyah, if you wanted to speak, but I will allow your mic. If you wish to speak, please go ahead. There may have been an accident on their end. Okay, DezBaa, back to you. We have no more hands up.
All right. So to the points of that Esteban has brought up, and Greg and Vincent, yeah, to kind of starting off with Greg's first though, yeah, that there are going to be a list of things. Basically, it's going to look almost similar to all the other committees where we have like the purpose and the responsibilities that have been outlined already by the Department of Health and what the committees are meant to provide. But then also how we're going to be interacting. I just kind of touched on it a little bit where I do encourage people from outside of New Mexico to go ahead and speak up. Anybody can speak up, especially, I mean, we've had a couple of people who say that they don't want to speak out of turn when it comes to cultural considerations, but we do have people who have lived on the reservation who are non-native, for example, and have their own consideration for what that might look like when it comes to working. But I feel that tribal governance is its own separate thing that will require a little bit more nuance, and also with the help of the tribal liaison, as I had mentioned earlier, to be able to provide, as I see it, the access and the opportunity to be able to implement it within their own governance as needed, as wanted, so that no agency is lost between that. And but I mean self-governing agency, because we need to respect that. When it comes to the idea of indigenous wisdom, to me, I feel like maybe this is lost a little bit, but it's almost inherent in the medicine itself. If we're making sure that we are listening to the communities, that to me is inherent in indigenous ancestral wisdom, where we are listening to the community and the needs of the community. In some ways, it is trying to find that balance between a colonized mindset. Well, this is what we feel like is necessary to happen for the people as a governance, right? Finding that balance between what does it look like when we are listening to the needs of the people, and also how we are going to provide an environment governance so that we are able to have access to for everyone. And that to me is the equity, where it's not just so much like what you're able to pay for, right? But we also need to be able to, moving into what Esteban was talking about, is also taking care of our own community, whether it's the propagation culture cultivators and what that looks like for them, as well as how is it also the chain of command moving forward to get into the hands of the facilitators, administrators, and into the hands of the patients, for lack of a better definition. And that's one of the things we probably should also continue to establish. But again, back to, as Greg was saying, with the intersection, and as I was mentioning, a lot of what I feel like it's going to go back and forth. Definitions are going to be provided to from the different communities and what that looks like. I feel like I would probably propose, this idea of indigenous ancestral wisdom, which I feel is a lot of what some people are looking to have a definition of, and understanding what tribal governance and sovereignty is also, what also that looks like. To feel like we're not overstepping and out of our bounds and out of our element when it comes to talking about either or each. I definitely would like to have more Indigenous representation in the meetings, but then that goes back to more people providing the links and sharing this information with as many people as possible, that these are the things that we're looking at. I know meetings like this, and even with the city council, here I am in Santa Fe, it's very hard to get people at the right times, either after work or during work, to be able to provide the input and to have a voice. And this really is an opportunity to share your voice and your concerns and what it really means to serve our constituents and our fellow community. What was the other thing that I was trying to remember? That was Esteban, Greg, and Vincent with, yes, oh yeah, Esteban was with the regulations and the sunset clauses. That is something that we will definitely be looking into, because again, we're not trying to necessarily say we all understand that this is something very new to New Mexico, and our training does not necessarily come from New Mexico, but we are looking into ways that people who are going out of state, right, for their training, what that looks like, but also that, this is a great opportunity for everybody. And we'll definitely look into those. So as I'm putting all of this information together into something that can be voted on, as far as recommendations for regulations to the board, these are some of the important concerns that we will be eventually voting on together, and where, again, like, I hope that we can have several people involved in the process. What it looks like is it might be like a matter of at least, a simple majority, depending on how many people are actually attending. And there are going to be a lot of different committee meetings throughout, and it's going to get your head's going to start to spin like mine is, if it hasn't already, to be able to be a part of it. But back to the intersection, how we are helping inform the other committees when we're making sure that this is the opportunity to voice up and say, okay, patient care, did we actually look into this with regard to patient care? Did we look at this in terms of end-of-life care? As a possible example, if there are elders who are on Medicaid, or any other elders who may not be able to pay for, medicine, what does that look like? How are they going to be able to have access to it? And just making sure that the language is in those recommendations, and with respect to equity, access, and cultural considerations. And it could be anything. When I'm thinking of end of life and what the care looks like, I'm thinking of tribal traditions. And I'm just saying something. I'm saying anything. But it could be all of these considerations that we might have. And one more thing, because I know we're also running out of time again, and I spent my whole time talking. One of the reasons why I came back to New Mexico to have my child when I was living in Massachusetts was specifically for the fact that New Mexico labor rooms allowed my family to be there with me. In Massachusetts, they said I only was allowed 2 people in the delivery room. And I said no to that. I came home to New Mexico and I had my child here because they understood that I could have as many people as I wanted in the delivery room with me. I was able to save the placenta for my child being born, and there was no one who gave me any fuss about it. I didn't have to explain myself. So these are the kinds of places where cultural considerations and Western medicine can intersect, and why New Mexico is a unique place for these types of things to happen. And I want to have those considerations be a part of what it looks like to be able to partake in this type of medicine, whether it is coming from curanderas, massage therapists, lawyers, whatever it is that we feel like the person who should be able to provide the access to this medicine. And that's all up to you. It's not necessarily up to me. I'm just here with the microphone and the video camera right now, but we need to hear everyone's thoughts on what that really looks like. And I can't do it alone without the help of people providing that input to what it looks like. Otherwise, I feel like it's just entirely one-sided, and it's just a soapbox. It's an opportunity for any one agenda. So I really need all the different communities' input, and that's why I was considering possibly, and with the input of the Department of Health, whether or not it would be possible to do some more in-person outreach, hybrid meetings, and to possibly go out into the rural areas, you know, time permitting, and be able to just gather that kind of information and concerns from the mouths of Mexicans. So anyway.
Thanks for that. We have a hand up there from Dominic Zerlo. Dominic,
yeah,
please.
Dominic, please chime in. Tell me where I'm.
Thank you. No. You're doing just fine, DezBaa. And you know, some of the considerations you're talking about, it's actually why I had raised my hand. And some of it, with regard to in-person meetings, we were having some of these discussions as well, and we've brought it up in some of the other meetings and some of the other conversations, that in-person is great and they absolutely can happen. We just need enough time to schedule them, locations and places. We do have in the chat, there is actually one individual, Deb Thorne, who actually said that they are willing to host in Las Cruces, for example, and not that that's necessarily a rural area of the state, but it's more accessible to people in the southern areas of the states, especially the southwest area. So those sort of things can happen. We just recommend right now with the winter weather to hold off on that, especially in the more northern areas, but it's good for the southern areas of the state. That as long as they're hybrid, so people who may have weather issues or not able, even for reasons other than weather, are able to attend, you know, because if there are some people who are not able to travel for whatever reason, they could then still attend through virtual means. We're happy to help set those on up, and we're willing to do that. We just need a little time. We do also just recommend that that not happen until after the session, because during the session, any of us can, and many of the people who are involved in these committees can get called to the roundhouse at any time. And it also would limit the potential involvement of some of the sponsors of the bill, who, as most people know, are still very active and involved in implementation. So that's the only reasons we say wait. But the session is only a 30-day session. So, you know, that means end of February we could do it, which if we want to set some of those dates up, we can start working on that, and that's not a problem, because that'll give us time to be able to do that. The other thing, and why I actually had raised my hand initially, is also that, as a reminder, we have 9 positions for the board, but only 7 are filled. And so we are actively looking for other individuals to help fill those other two positions. And we especially would like to get representation from communities that have not yet been represented, and additional representation from ones that have been underrepresented in the past. Now, that would be a lot to do with just two positions, but we want to try to do as best as we can. So we are actively looking for individuals. And if you are interested in that, the qualifications and the application are actually on the advisory board webpage, and it is the site I just put into the chat. And that is www.nmhealth.org/about/MCPP/MPP/MPAB/. And if anybody has a way that we can reduce those sort of letters, it would be great. But again, it is in the chat there for everyone. And so with that, I'll turn it back on over. Thank you, everybody.
Thank you, Dominic. And so please share that information with all of your networks and your community, someone that you feel might be a really good candidate for that. We really need more. I cannot emphasize that enough. We need, in order to be able to create this network for our community, we need to get the word out and have these conversations that may be kind of difficult for some of us to continue to have, or even to start. Do like me. I'm the example of getting out of your comfort zone. If anything, is to just, find the time to talk to somebody, that it's just needed. I've seen enough, and I've seen plenty of instances where, I know that this medicine works, and the integration process of it is important. And don't forget that you are your own medicine, and don't forget your own power when it comes to reaching out and talking to others. Regardless, especially right now, we need more connection, more support, more compassion, more love. Let the medicine do its work within your life when it comes to sharing that, to help others get involved, and the amount of concerns and input that we really need from you, from New Mexico. So with that, I think I will conclude. What kind of?
Sorry. It was just
yeah.
Pardon me. Yeah, you go ahead.
What more input did I want? Just things to look out for. I know that I'm sorry. Well, here's the thing. My brain is so spun out from being at the Roundhouse earlier today, dealing with my 13-year-old and a lot of the other stuff that. What is the input? Don't forget about X, Y, and Z when it comes to equity, access, and cultural considerations. With respect to medicine, the psilocybin, what does it look like? Like I said, I've heard about insurance, telehealth, rural. What does that education looks like? I guess maybe the homework for anybody would be, if you were having a hard time trying to start a conversation with someone about the benefits of psilocybin, what would that look like? What kind of educational tools? And I'm not saying this is the only one, but this is an example. What would be an educational tool that would be necessary and needed to help facilitate that connection with another person? To me, that is providing someone with the agency to choose on their own if this is the right path for them. And what does that look like? And if a barrier was money, then what does that person need in that particular area? How would they be able to get it? It might be different in Espanola than it would be in Crown Point, or even a checkerboard town, Gallup. It might be a religious barrier. It could be a political barrier. It could be a reading barrier. It could be an accessibility barrier, right? Whether or not it's someone who, any kind of accessibility issue that might be a challenge. Okay, so Greg, you got a minute. Oh, is it Aaliyah? Aaliyah, let's.
No, I just really quick, like, would it be too remedial to just like start writing a list of disparate sections of our society? Like an impossible task, of course, but like, can we just? Yeah, equity is so broad, and I think like the cultural considerations need to be in some way defined. It's like, what does Española need? Like, but we have to define what Española is, right? Española could mean this to one person and that to another person, and tribal nations could be one thing in one area and to another thing in another area. And it's like, how can we start to like really just define what the work is, to provide access and access to information, which is again like kind of that like partner arm of the education module of our board. Anyways, just some thoughts.
Thank you for that. We also have Aaliyah. Let me just try to allow their microphone. Aaliyah, when you're ready to speak, please unmute.
Hello, can you hear me?
Yes.
Great. Hopefully I can get my thoughts and working in a stream here. I'm really concerned also about the affordability and access to a really broad spectrum of people in the state. And I've read part of the bill and looking at what the qualifying conditions are for depression and post-traumatic stress disorder and substance abuse and end-of-life care. But then it also, number 5 is other conditions approved by the department. And I've heard a lot about, so that's pretty open as potential medical benefits. And mostly I've been hearing about using the psilocybin in full doses, but there's such an incredible potential benefit of microdosing and for a broad spectrum of medical benefits, and potentially creates a lot more accessibility and affordability for a lot of people, if they're not required to, because you're not feeling high from microdosing, and if you're taking the right dose. And it doesn't, people, so far I've heard that even with microdosing, if that's accessible, that somebody would have to have a care person there, but that doesn't seem like it really makes sense, and or that it's not really necessary, and would make it make the medicine more available to a broader spectrum of people. Some people need the full dose, but some people don't. And microdosing helps people to be able to keep functioning in their day-to-day life, and they don't have to be with a care person, a therapist, for hours on end, or even necessarily at all, unless something comes up, and then they contact a therapist to support them. So I'd really like to see the microdosing be brought into the picture more as well, and more talk about, having that be accessible without having to go into a center and sit there for hours or however long the board decides is being required. Anyway, there's so much that people can benefit from microdosing as well. That's mainly what I wanted to say at the moment. I just wanted to bring it into the conversation.
Thank you for that. We also have a hand up there by L. Byers. So L, or Ellie. Pardon me if I mispronounced it. I have unmuted you. Please go ahead.
Thank you. I know you got it right the first time. It's Elle. You all can hear me, yes? Yeah? Okay, cool. So just hearing some of like the qualifications, I guess, in order to access the medicine, something that came up for me right away was like being diagnosed even with something like depression or PTSD, and like how and what that looks like in New Mexico. I've stated before when I've been in this group that I am from New Mexico, but I'm a social worker in New York City. And I know out here, like, we don't have very many providers to meet the demand, and wait lists are long. And then also, like, thinking about who's more likely to get a diagnosis and how you have to present yourself in order to get a diagnosis. That's just something, I guess, that like came up for me. And I don't know if that's like too large of like this is a real big systemic thing. But it is something that came to mind to me, is like someone's ability to get a diagnosis like being a barrier also, I think. And I wonder how we might be able to sort of like negate that barrier or like reduce it. But yeah, just thought I would throw that one out there too.
Thank you for that. We have no more hands up.
Just a quick question on, I missed the part when for Elle, you were saying to negate that barrier, and my mind kind of went for a second. Do you mind saying that over again? As far I know, what I got was that there weren't very many providers in New York City, and it had to do with there was how a patient or a client or a person would present themselves to be able to be diagnosed to, and I kind of lost. And I know we have a note taker, I totally get it, but this is just for my for me to hear what that again about negating something barrier.
Yeah, I mean, I'm not sure in this moment necessarily like what the solution would be, but in my experience, there's like two things, right? So one is the demand being insanely high and there not being enough providers, and it taking a really long time for someone to even get seen by a provider, let alone receive a diagnosis that would qualify them to be able to like have access to this sort of medicine. Um, so that's one, right? Like who are the providers that can provide diagnoses, and why are there such long wait lists and stuff to be able to access those providers? And then two is like, you know, the DSM was written by a bunch of white men. And so like patients have to present themselves in a certain way a lot of times in order to obtain a diagnosis. And particularly for women of color, it can take longer and you have to go through more providers in order to get a diagnosis. So those are just two things that I was sort of thinking about hearing, like, oh, you have to be able to have like depression diagnosed or PTSD diagnosed. Like a lot of people self-diagnose themselves because getting that diagnosis, there's a big barrier in that in and of itself. Does that make sense?
Yeah, and I think that since, and I apologize, I completely forgot that we don't end at 6 o'clock. I even got myself confused with my own time. My meeting time here. What I'm hearing from you is, and also Aaliyah, is an intersection of, you know, what are other conditions and how those two interact with each other. And just a little bit of a reminder, while these are definitely good points, especially when it comes to looking at the framework of medical psilocybin, that what we're trying to roll out at the end of the year, and Dominic can definitely speak to this a little more if he wants to, is how do we get started? What is our starting point so that we can move forward with the possibility that it might move into a place of people microdosing with their own agency, what could that possibly look like? I don't feel like we're looking at that just yet. But the starting framework is, how do we get started? And it might be, to a good point, to what you're saying, Elle, and this is like a cultural consideration. This is the access and equity of it is, what does that balance look like, and that ratio of providers to patients? And I'm not going to say that we're going to get it right the first time, but eventually, is there going to be an oversaturation of mushroom cultivators and people who are doing propagation? We don't also want that either. I feel, at least this is my own personal opinion, just to say, we want to make sure that it is a viable source of income, right, for the people who are providing it. Some people may look down on that because they feel like money should not be exchanged, right? But also at the same time, money is energy. People's time is their energy and their love that they put into creating the medicine for people to share it with others. I think in Colorado, that was one of the things, you can share the mushrooms, but no money should be exchanged when it comes to that. But that's a completely different regulation. But again, it's like, what's the starting point and what are we looking at? These are the things that we do need to be considerate of in the future. And especially, like, they didn't start diagnosing women with ADD, right? And I totally understand that. I totally get that. Women present completely differently than men do. Kids even present differently than adults do, especially when it comes to diagnosis. So that is something that is important to look at. I would encourage Aaliyah to possibly try to find the dosage, maybe just to listen in on the dosage committee, patient care. I think there's another one that Ian is the chair of, but dosage is more probably going to be medical. But also, I think there is the propagation. Like, we're going to be talking about this. We're going to be talking about the cultivars, the different types of mushrooms that may or may not be available. What does microdosing look like? What are those regulations? What does a heroic dose? We all kind of agree on that. But that also can be dependent on the type of mushroom that is being offered. Aborts, for anyone who's familiar with that term, might be massively more potent than their regular adult counterparts, and that might be completely different. And all of these things are going to possibly be taken into consideration. Someone's microdose at 0.3 milligrams is going to be completely different than someone's 1 gram microdosing. Some people just have a different tolerance than others. But what does that look like when we're kind of creating the framework? So all of this is definitely important, and it's worth considering. And hopefully that maybe even actually this committee in and of itself is like the information of where to go if you have a concern, because I'm doing this at 5 o'clock and not everybody else can be available at 11 o'clock or 9 o'clock. And so I don't mind being like, go here, go this, go talk to this person. That's a great concern. Bring that up with Ian, bring this up with Chris, and so forth. I don't mind that. That's like the information highway and the, find out information here.
Just a quick one. We have 2 hands up there.
Sure.
Malena Robbins, I have allowed your mic. Please begin when ready.
Can you hear me okay?
Yes.
Okay, great. Thank you. I would just like to contribute the fact that New Mexico borders Mexico, and we talked a little bit about indigenous knowledge systems, and if we think about the trade routes, the ancestral trade routes that have gone north to south for millennia, for thousands of generations, and have now been cut off by this political border, that the medicines are traveling and they're wanting to engage, and they're wanting people to reinvigorate or reawaken these trade routes. And so I would just like to add the Mazatec, and maybe building some bridges there, finding Mazatec organizations. Maybe there's Inti Flores Garcia, I think he's working on a museum about Maria Sabina. There's the botanical dimensions. Just a quick, even Google search. The Fungi Foundation has the ethnomycology ethical guidelines on how to engage with indigenous peoples or engage ethically with fungi knowledge. And just here, I can share these resources in the chat. But yeah, I think when we're talking about indigenous knowledge systems, and this is just a scenario that I've been kind of playing around with, is say the Navajo Nation is asking for psilocybin assisted therapy, a culturally informed psilocybin assisted therapy model, then what would it look like to have traditional Hatashi medicine people engage with Masate curanderas who have knowledge about how to hold these mushrooms in ceremony and build a model that is taking into account teachings from the Masatec ceremony, but also teachings from Diné ceremony, whether that's language, ceremony, food systems, prayer, protocols, practices, and then also the Western therapeutic model. And how do these systems of knowledge engage, teach one another, and learn from each other? Because I think there's this balancing act between indigenous science, indigenous ways of knowing, and then Western science and Western dominant Western paradigms of practice. So how do we find an equilibrium between the two? Thank you.
Thank you for that. We have one last hand up by Brett Phelps. Brett, I've allowed your mic. Please begin when ready.
Hey, good evening, everybody. Glad to see everyone here virtually again. Just one thing I wanted to throw out for this committee, you know, included in the statute was the equity fund, the patient equity fund, which was created but was not funded. And so any members of this committee would just encourage y'all, you know, the legislative session has just started. And Dominic, if you have any guidance on this, I don't know if DOH is working on this as well, but advocating to get some of that funding from the legislature this year, I think would be fantastic. You know, I know we're all pretty busy, but if anyone wants to, you know, go do that up in Santa Fe, I would strongly encourage it. I'll be up there trying to push for that and get some funds for that, because it's currently not included in the budget, at least the latest I had seen. But that's just one thing I wanted to mention. Otherwise, I really like what this group's doing, and yeah, I'm happy to keep working with y'all.
Fantastic. And Dominic, please go ahead.
Thank you, Brett, for bringing that up as far as the equity fund. That actually was a part of what DezBaa was talking about earlier, as far as, you know, what can we do with regard to ensuring equity and access? And when the statute, when the bill was originally presented, it was with the equity fund with $1 million per year allocated towards it. And then that did end up getting taken out. The fund was created, but the funding was removed. It is not in the current executive budget. And for those who are familiar with regard to what state agencies can and cannot do, I cannot advocate one way or another for it. However, the original idea, and mind you, this is the original idea, is that equity fund would help, especially with regard to individuals in rural and frontier areas, to be able to help with people who had transportation issues, people who have historically been neglected by the medical establishment in being able to get treatment, whether that be from a diagnosis standpoint, all the way through to treatment, therapy, everything else. And so I do know, and I don't mean to speak for him, but I do know that Senator Steinborn, who is one of the primary sponsors of the bill, was really trying to see what could be done with regard to that aspect from the equity fund. So the equity fund and the research fund were both created but not funded during the original session. Hopefully we'll see some change in that here in the future, but again, I can't actually advocate one way or the other. However, that does not stop any of you from advocating one way or the other. I just can't also tell you what to advocate for with regard to the legislature. So how's that for walking the line? Anyway, thank you, everybody. I appreciate it. I did just want to also note that, it's really important to read through the full statute to see what the statute allows and does not allow, because there are a lot of great ideas and a lot of areas that can be explored down the road in the future. But the statute is pretty clear as to what we can do, and really to read through it and understand. And if there are questions about it, we are going in at some point in the not too distant future, actually have during one of the meetings where we're going to talk about exactly what can and can't be done. But we don't want to disturb the free flow of information and bias people during this right now. And so just to let everybody know, that is actually something that we are looking at doing down the road, so that people have a better understanding of what can actually be done under it. And the important part about this is to help us figure out ways to still improve access and equity, even with the strictures and the restrictions put on us by the statute, but still staying within the statute, if that helps make sense. And with that, thank you. Back to you, DezBaa. I don't think there's anybody else currently with their hands raised.
No, but I do want to ask a couple of questions on that, Dominic. When it comes to allowing people to look up information, when it comes to maybe organizations who might have more information on what they're looking for, like the Healing Advocacy Fund. I know that some people are working towards the language and talking to legislators about it. So I don't know what information we can or cannot provide as far as like it's out there to talk to the legislators and tell them what you feel is important to you, you meaning New Mexico citizens. But also to your point, I just for the sake of saying so, I mean, for a lot of us who may be having done the work in this field for a really long time, a lot of the longtime advocates, just to be mindful that there might be some new people who are not used to what the intersection of government looks like when it comes to these regulations. A lot of us have been underground for quite some time and know a lot of information, have a plethora of knowledge when it comes to either growing or set and setting and ceremony. But that's also kind of where I feel like the equity and the access does come into consideration when I'm saying the education part of it, at least for me, when we're looking at it, is what do the new first comers need to have as far as like, this is something that is beneficial to their growth. And we also can just learn something new all the time. We may have been stuck in this framework for a really long time when it comes to legalization, or when it comes to only coming at it from a Western medical point of view. We all have a bias. We all have an agenda. We all have our preconceived notions about how things should be done or what's the best way. And I just encourage that despite that, we really look at what it might also be for those who have never had the opportunity. And those are also to the people that I want to make sure that this medicine reaches. So if maybe there is a redundant question, and we, like to Dominic's point, at some point we're going to start kind of, being a little bit more structured about how we're going about this. What does it actually really look like? And I don't want people to feel afraid of voicing something that they feel is really important. Again, to be, I'm from Santa Fe. I am coming from this frame of mind, is that if we were all thinking the same thing and we're all seeing it from the same point of view, there wouldn't be a reason to have so many different voices. I feel like it's just us experiencing, the beauty of the world through each individual different person. And so your thoughts and your concerns and everything that you are wanting to know and would like to know through your own prejudice or bias is important. And that's why I do want to listen when it comes to what people have to say. And even if it's something that I may not hold dear to me, or that might be in opposition to someone else, we don't get to work through these things siloed and away from each other. This is an opportunity to grow, not just as individuals, but through this process of how do we take care of each other with the government involved, so that it is equitable. And yes, that is a big word to chew, but we're all doing our best, and I'm not assuming that I know what's best. And I definitely appreciate all the input, whether or not it's coming from a place of, quote, ignorance or a prejudice or a bias. That helps us learn how we better need to communicate what needs to be said and how it needs to be presented, so that we are all on the same page eventually. And then we can go further from there, so that we can implement some of these great ideas that a lot of us have presented over the past few weeks that may or may not actually fall into the framework of medical psilocybin governance that we're trying to get going at the end of the year. All right. I have 5 minutes left. I don't think anybody else has anything else to say. If you want to get like one last word in, Dominic or anyone else.
I just want to say thank you, because it's great to see the questions, especially in the chat, and that the different speakers have brought forward, because this is exactly what we need to hear. It's exactly what we want to hear. We want those differing viewpoints. We want to be able to figure out how can we create the best program that can reach the most people, and especially the people who need it. And so it's really great to hear this. So just thank you to everybody. And for those who are wondering, there's additional information being put in the chat. So thank you, Deb Thorne, for posting those links, and all of, I mean, it's just really great. And as far as posting broadly, Greg, I can answer that. Yes, you can. That's just not something that the Department of Health can do.
Yes, post without the horns blaring. All right, well, thank you, everybody. Have a great evening. Get some dinner if you haven't. Get some rest. Drink some water. Don't forget to take care of yourselves, because you're important. Bye.